Good evening, everyone. Welcome to tonight's Ask the Art. I am Becky Shields. I am the Advocacy and Research Manager at the ARC of Indiana. And tonight we are very lucky to have Kim Dodson, the CEO of the ARC of Indiana. She is going to do a recap of the 2025 legislative session. Just some housekeeping for the webinar tonight. The chat is disabled, but if you have any questions, at the bottom of your screen, there is a Q&A. You can type your questions in there, and we will answer those as they come up. So thank you all so much for attending tonight, and I am going to hand it over to you, Kim.
Great. Thank you, Becky. And hi, everybody. It's good to be on with you and share some news. Really glad that you guys have really stuck with us this legislative session. Just really want to start off with a big thank you. This legislative session, it was really proven how impactful the ARC of Indiana is at the Indiana State House, and that's because of all of you. So many of you took the time to educate your legislators, to reach out to legislators, let them know the bills that were important to you, shared your Medicaid stories. And we heard that loud and clear all throughout the State House. So thank you very, very much for that. I think we say it some, but we never say it enough. We can't do what we do at the State House without you. So again, thank you for being by our side through all of this. It's appreciated, but we're going to need you some more. I think that this year is going to be really, really interesting. And so I'm going to start off with just a few reminders and things that are happening before I really dig into what happened this past legislative session and then what's happening in DC, just because there's a lot of stuff going on. The ARC of Indiana is going to continue to do bi-monthly policy updates throughout the summer and fall. There, quite honestly, is just a lot going on and a lot is changing. So we want to continue to stay engaged with you, continue to make sure that you're getting good, accurate, up-to-date information, and continue to ask you to contact your legislators and contact your congressional delegation members as well. So we're taking this Friday off. So our next memo will be coming out next Friday. If at any time you guys have any questions about anything, please don't hesitate to reach out to us and ask us a question. But again, we're going to be doing those updates on a bi-monthly basis. A couple of things that are also happening is we had talked, I think the last time I did this, about the Applied Behavior Analysis Working Group. So this was in reaction to the old administration putting forth some guidelines for applied behavior analysis, or ABA therapy, putting it so that it was a 3-year maximum limitation that was retroactive. And then also talking about some weekly, hourly minutes. Some of that is still happening, but what happened was the things started by the old administration stopped. And then the new administration said we're not going to make this 3-year lifetime cap retroactive. We're going to make it starting going forward. And then we're also going to kind of tier the hourly limits on ABA. Both of those things are still concerning, and we're very aware of that. But it at least was a win for the time being. Also because the governor has put together this ABA working group. So this ABA working group is going to start working yet this month. Just got notice yesterday that they're hoping that they meet for the first time by the end of this month. And then I think they're going to plan on meeting monthly. They do have a report to go back to the governor by September 1. The working group is headed by our FSSA Secretary, Mitch Robe, and then also our Secretary of Education, Katie Jenner. So they have put forth the members of the working group. I don't know who all is on the working group. I did get a letter inviting me to be a part of that. I know there are some legislators a part of that. I pushed hard for families to be a part of that, but I have not been told who those families are. So I guess I'll wait and see on when we have our meeting to see who's all sitting around the table with me. But again, that will be getting started within the next couple of weeks. Also taking place is the DDRS Advisory Council. The DDRS Advisory Council will be holding a special meeting on May 21st. This is a meeting that is not open to the public, I'm sorry to say. And this is a meeting that is specifically put together as a result of House Enrolled Act 1689 that was just signed into law by the governor a few days ago. That talks about the extraordinary care definition for the state of Indiana. So good news is that our leadership at DDRS Advisory Council worked very much with us throughout the bill moving through the legislative process this year. They know how important it is that they get the definition of extraordinary care correct. And so they went ahead and even before the end of session, put forth this date for the special session of the DDRS Advisory Council. So I would tell you if you have thoughts and strong opinions or even states to look at and model for that extraordinary care definition, please send them to me. I am working with a small group of families who are very engaged on this issue to make sure that I appropriately represent their thoughts and their concerns. But I'm glad to hear from anybody. So please send anything to me via email that you think needs to be addressed there. Tomorrow, the Seclusion and Restraint Commission is meeting over at the Government Center. I think publicly I've kind of criticized this group a little bit for no other reason than we don't get together very often. We're not getting good data that's being collected by the Department of Education, and that's not a criticism to the Department of Education. I think schools just, for some reason, are not reporting information accurately. At our last meeting of the commission, that was late December, we talked very openly about just being concerned about the data, being concerned about, again, just how often we were meeting and needing to do more. So the Department of Education has committed to meeting more regularly. By statute, that was changed last year. We do have to meet now biannually. So our first meeting is tomorrow. And then our second meeting for the year is already set for early fall. We will probably be putting together some subcommittees to start some work over the summer. We are needing to update the model plan and the model incident report that the Seclusion and Restraint Commission had put forward before for schools to use. It has to be updated to also include timeouts and timeout areas. This was because of a law that was passed last year. Again, when we got together in December, we had not done the work that we should have been doing over the summer. And again, I'm really pleased that the Department of Education kind of heard our concerns and really heard our constructive criticism on how we might be able to work better and be a little bit more effective in the work that we're doing. So I'm looking forward to that getting started. And again, look forward to where that's going. To just talk a little bit on what to expect this summer at the State House. Don't forget that there's always interim study committees that will start. They're called summer interim study committees. They usually start very late summer, usually August, September. They usually have to be done by November 1st. For budgetary restrictions, sometimes those interim study committees only meet once or twice. It really depends on what they are asked to study. The way that things are decided on what to study is legislators put forward some issues to study to the Legislative Council, which is made up of leaders of all four caucuses in the House and Senate. They kind of take those letters and suggestions of what should be studied, and then they kind of parcel them out to see, and they have to vote. So everything that is suggested does not get on the list of things to be studied. So that's kind of the way that works. We should learn those interim study committees sometime in June. So what will happen is the Legislative Council will set a meeting. That meeting is open to the public and it's live streamed. So they will have a conversation about various issues. But one of the things that they will discuss is the suggested items for interim study committee conversations, and then they will vote to see what items go where. Stay tuned for that. Again, we should know that by July 1st. And we'll be paying attention to anything that, impacts the issues important to people with intellectual and developmental disabilities and their families. One of the other things that we can expect this summer is a technical corrections day. One is planned every year after a legislative session. Again, we expect that to be planned for June. They don't always happen. So usually after the legislative session ends, that's when legislative services, the agency at the State House, really starts digging into all of the bills that became law. Every once in a while, the legislature makes a mistake. And they're kind of technical in nature, a period where there should be a comma where there should be a period, wrong statute number, something like that. All of those technical components are what is generally discussed at that technical corrections day. We don't have a date yet for that, but when we do, we'll share that. The reason why I think it's important to know where that is this year is, if for some reason, something major happens at the national level that the Indiana legislature or the governor feels like they have to come back to a special session, rather than calling a special session, they might use that technical corrections day to do something bigger than just technical corrections. And we'll kind of talk about that here in a little bit as we kind of dig into some issues, but just kind of wanted to put that on everybody's radar. Also want to continue to ask you guys to send us Medicaid stories. There's a couple different ways you can do that. The easiest is to go to our website. There's a link there that you can click on. Please send us Medicaid stories. We are continuing to have conversations with our Indiana lawmakers and even more importantly, our DC delegates. So when we went to Washington, DC in April, it was really nice. We delivered a couple dozen of Medicaid stories to each and every congressional member, and then we did over 100 of those stories to both of our senators, Senator Young and Senator Banks. Those things make a difference. And I've already gotten some feedback from some of those staff people. So we are continuing to collect those stories. We are going to need each and every one of them and know that our team reads them and we will use them as issues are being discussed in DC and also as things continue along at the state level. Becky, thank you for putting in that link. Please go into the chat and you can grab that link and again submit your Medicaid story. Okay, I'm going to talk a little bit about the legislative session. It was a really interesting legislative session. I think, when I talked to you all a couple months ago, we were just getting into the legislative session. We had a bunch of new legislators, but most importantly, we had a new governor and a new FSSA secretary, and we were really starting to get an understanding of who all was going to be in place, how we were going to work with them, and kind of what their priorities were going to be. I think we were all pretty concerned about, the direction the legislative session might go. And I think the way that we ended it is we're cautiously, I don't even want to say optimistic, cautiously hopeful that we're going to continue to have really good relationships with the administration, really good relationships with FSSA. I will say very much, I'm very appreciative of our FSSA Secretary, Mitch Robe. I think many of you know that he was FSSA Secretary about 20 years ago. And under Governor Daniels, we saw a lot of cuts to a lot of programs, and we saw a lot of cuts that were not very well thought out, right? It was all about getting Indiana back to a balanced budget, putting a surplus in place for the state of Indiana, and making sure that Indiana was continuing to prioritize the K through 12 education. All of that happened during Governor Daniels' administration. And I think, all of us who care about so many programs really felt some pain as a lot of our programs were cut, eliminated, and again, kind of saw some changes that weren't necessarily positive for people with intellectual and developmental disabilities. But I will also say that that was the administration that continued to close our state-run institutions for people with disabilities. It is something that Secretary Robe is very proud of. And I think since his time with us, he has really gotten a better understanding of the importance of Medicaid to people with disabilities and their families. I think he has really grown to understand just what a lifeline Medicaid can be for our specific population. And so he has absolutely come into his role the second time with a lot better understanding. And I'm very thrilled that he has kept the leadership team at the Division of Disability and Rehabilitation Services intact. And I think that's the best that we can ask for because what I didn't want, to be very honest, is to go into this legislative session, know that there was going to be a lot of criticism and scrutiny on Medicaid and not know who I was dealing with and be, presented with somebody who I didn't know and have to build a relationship with them at the same time that we're pushing them to continue to fund Medicaid, continue with, the waiver redesign and reset, and just kind of, push them and educate them on Medicaid. So to have, again, DDRS in place and then Secretary Robe there, I think is a good thing for us. Not to say that he's not going to do things that upset us and make us mad. He absolutely will. But I think we have a really good relationship with him that we're able to educate him and inform him. And he will use that information to make the best decision that he thinks is in the best interest of our states. And that's really all that we could ask for. I think again, as we look at this legislative session, I think we can feel really proud that some of our priority pieces of legislation did pass. One of the key bills that we were very much pushing was House Enrolled Act 1689. It's now House Enrolled Act because it's officially been signed by the governor. This was a bill that, again, very much came out of the Medicaid changes and cuts that was made in 2024, largely around the attended care, structured family caregiving piece, the way the state had decided to really care for those with medically complex conditions. We kept hearing from families that things were not going well. We did not want the issue to die. And we made the difficult decision of, again, in this time of unknowing of, again, who our FSSA secretary was going to be, kind of what the motives of our administration with the governor was going to be, and where our Medicaid forecast was going to hit. We didn't want those issues to not stay in the forefront. So we at least wanted to introduce a bill that kept those issues in the forefront, top of mind of people, but did not, do anything that we knew was not going to be well received by this new administration as we, rebuild our relationship with them and get to know them. But we were really happy that one, the new FSSA administration very much supported House Enrolled Act 1689. They worked right alongside of us. Both around, what was next for the extraordinary care definition, also making sure that the DDRS Advisory Council had an opportunity to hear from the administration about what they were going to be putting forward as far as the next round of waiver amendments to CMS, that they have to present them to the DDRS Advisory Council. They have to have a conversation with us around that. I'm very uncomfortable with the public comment process, right? When all of those the amendments go out, they're open for public comments. We know what comments we make. We also have a pretty good understanding of what other advocacy groups are putting in there, what families are putting in there. And then for that process to not be public, is, just kind of makes me a little bit uneasy. So to have a bill where, some of that process gets a little bit more transparent by having some of these conversations take place with the DDRS Advisory Council in the public meeting process, I think is going to be really good for us. I think, again, it allows us an opportunity to engage in a conversation, to ask good questions. So we're really happy that FSSA supported us in doing so. We also know that there's just some good data that needs to be presented. I kind of feel, a little guilty that that we have to pass a law in order to get data, but the past administrations has made us pass laws in order to get reports. So hopefully that changes with this administration. But House Enrolled Act 1689 puts forth some reports with some really good data that will go not only to the DDRS Advisory Council, but also to legislators. So again, we can continue to dig into these issues, see what's happening, and see how people are now being cared for, which I think will kind of lay the foundation for future bills for the next session. So I think all of that is a really good thing. And we'll see how that goes. But glad that, again, the DDRS Advisory Council is, moving forward with that extraordinary care part that's going to be taking place in a couple years or a couple months, couple weeks. One of the other bills that was really important to us was House Bill 1285. This was our special education bill by Representative Cash. Originally, it included cameras. If you guys are paying attention to the news, there's some situations happening now that cameras were a good thing on a bus, but they need to still be in certain areas of schools to make sure that our students are safe, especially those students who aren't able to communicate with us as clearly as others, so that we know what's happening in kind of the hallways of the schools. But there's still some really important components of House Enrolled Act 1285. One, it does mean that at least one person in a school has to be trained in nonviolent crisis intervention, which is again really important because we do want to eliminate the use of seclusion and restraints in our schools, right? That is our goal. So it does that. It also, we had heard from some families who, because only one parent was allowed to go into some of the case conference committees, parents weren't allowed to record those case conference committees. So we made it that now schools cannot have a policy where families cannot record those meetings. That's a good thing. We also had some incidences around the state where unfortunately some students passed away and or transferred, and schools very quickly removed belongings, very personal belongings from student lockers, student desks, before the parent could go in and kind of have that opportunity to, continue to grieve for their child or kind of work through all of those emotions. So it does say that a school cannot remove those belongings before a family comes in and has access to them. So that's a really good thing. I think Representative Cash is still very much wanting to move something forward around cameras. Um, we really made some headway in this issue this year. By the end of session, a lot of schools were not against the policy of having cameras in certain areas of schools, but they were concerned about the cost. And it all came down to money, quite honestly, of who was going to pay for it, how were they going to get paid. We had made some headway with the Department of Education regarding setting up a grant that schools could apply for to get cameras for some of these areas. But we, at the end of the day, we just couldn't get all of the ducks in a row in the right way to get something passed this year. So we're really hopeful that things will continue over the summer and into the next session. A couple other things that I will just talk about for the state is Senate Enrolled Act 486. This was a piece of legislation that I think is really important for people to think about because it creates a Medicaid Beneficiary Advisory Council. So in Indiana right now, the state is required to have a Medicaid Advisory Council of people who provide services. So all of the providers, Hospitals, nursing homes, DD agencies, they all have an advisory council where they meet very closely with the state Medicaid director, people from Medicaid, people from FSSA to talk about how Medicaid is going. It's very back of house conversations because it's about bills getting paid and all of the stuff that you don't necessarily see in the forefront of Medicaid. Last year, when CMS did their last access rule, they required all states to put together an advisory council made up of beneficiaries, people who utilize Medicaid firsthand. It does give the four caucus members or the four caucus leaders in the state house the opportunity to appoint somebody or suggest somebody to be appointed to that Medicaid advisory. So that is the President Pro Tem, Rod Bray, the minority leader in the Senate, Shelley Yoder, and then you have the minority leader in the House, Phil Giaquinta, and then you also have Speaker Houston. So they all four get to put forth somebody's name. The rest kind of falls to the secretary to be able to put somebody on there. We are going to, I've already had one conversation with the secretary, urging him to make sure that he has a good kind of array of people. We don't want everybody who utilizes the CIH waiver. We don't want everybody who utilizes pathways, right? We would at least like to have beneficiaries from pathways, from TBI, from CIH, from health and wellness waiver, and the family and support waiver, right? To me, I think that makes sense because everybody utilizes different services and waivers. We need to make sure that all of them are appropriately represented on that. That bill comes into effect in July, so we won't see anything really happen on this Medicaid Beneficiary Council until later this fall. But please know that we are on top of it, and we are going to be pushing FSSA to get this done sooner rather than later because we think that good conversations really need to be had. And I'll go ahead and take this moment to say, last Friday, FSSA Secretary Mitch Robe held his first quarterly financial review. I think this is really telling because this shows that Secretary Robe wants to be very transparent. He wants people who utilize Medicaid and distribute Medicaid right through our providers to be aware of the spend, right? What is the state spending on Medicaid? What are the areas that we need to be looking out for? What are concerning areas? Where are we spending more? So that we're not surprised by a $1 billion shortfall next time. So he will be doing these quarterly. They are, you can absolutely come in person, but they're also live streamed. I think this is really crucial because I think this is the type of information that this Medicaid Beneficiary Council needs as well. Because if you don't know, you don't know, right? It's very easy to say that the state has all of this money that it's spending in Medicaid, but this kind of shows where it's all being spent. And if it's being spent, more than what was budgeted, and more than what was allocated. So I think that's just really good information for us to have, and we need to use that to our advantage. One other piece of legislation, I'll actually mention two more, is Senate Enrolled Act 453. This is a tax bill, but most importantly for us, this eliminates the marriage penalty for people who are on the Medicaid waiver and have disabilities. So right now, your asset limit is $2,000 if you're single, $3,000 if you're married. It keeps it at $2,000 each person now under this bill. So this again takes effect July 1. If you are thinking about getting married, your asset limit will be $4,000, not $3,000. This is a big deal. We have heard this for I don't know how long around wanting to get something passed to around the marriage penalty. We wish it was broader. It's not going away. We're going to continue to push for this. This is a huge victory. Representative Rob Green, who is from the Shelbyville, Franklin area, is a huge champion on this issue. And quite honestly, he just would not give up. And so he continued to keep this in the forefront from the very beginning of session all the way through until the last few hours, and got it over the finish line. And we're thrilled that he was so committed to it, and so glad to share the news that it's now law. The last thing I am going to mention is Senate Enrolled Act 2. This is a bill that got a lot of attention throughout the legislative session. This is the bill that would have limited HIP to 500,000 people. It does not limit HIP anymore. It does absolutely streamline HIP, but there are a lot of exemptions around those work requirements. Of course, people with disabilities are a part of those exemptions. But what we're really concerned about in that Senate bill too is that marketing and advertising component. You heard it all through the legislative session. We very much appreciate the Indiana General Assembly hearing us, the ARC of Indiana, and other advocacy groups that we needed to be excluded from that. We are excluded from this bill. However, case management companies and IDD service providers are not. So what the bill does now is allows Secretary Metrobe to put together a rule as to how he is going to put forth advertising and marketing restrictions for vendors of Medicaid. We are going to work with him to push really hard that both case management companies and ID and not-for-profit IDD service providers get exempted out of that. The reason for that is because we know that when you all get a pick list, it can be very daunting to choose providers. It's very daunting to choose the right case manager. You need to know who is in your local community and what your options are. So we want to make sure that case management companies and IDD providers can continue to do resource fairs, sponsor conferences, all of those things to get out in front of you so you know the services that they provide, and that you get an opportunity to engage with them. One of the other things that we're really going to try to do is, some of our some Medicaid vendors do a lot of really good things around employment. And again, around sponsorship of conferences and information to again get the word out there about some of the things that we're doing. I think that again, the way Senate Bill 2 is written, it has some unintended consequences that some of these Medicaid vendors would not be able to, continue to advertise some of the things that they do around transportation, some of the things that they do around employment. And we want them to continue to be able to do that because that's very beneficial to people. And if they don't have an opportunity to showcase that, then those resources go unused. And that's not what we want to be doing. So I'm going to kind of move away from that for a second and talk a little bit about what's happening in DC.
Before you get to federal, um,
Sure.
we do have a few questions. So first of all, Dawn asked if she could get a list of the bills being talked about. I did go ahead and put the link to our HANA report in the chat so that everyone can look in the answered section of the Q&A, and that will show you where you can see all of those. And then Aaron asked, for the marriage penalty, is it different if you are receiving survivor benefits?
So yes, so this is not this does not eliminate the Social Security marriage penalty. This eliminates the asset limit penalty for those who are on a Medicaid waiver, HCBS waiver in Indiana. So Aaron, let's you and I talk about it if you have more questions, but it doesn't. It may not do what you might think that it does. Again, it's very limited. And I hate to say that. It's a big deal. It's a big deal, but it's a very limited big deal. So we still have some work to do around all of that.
And similar to that, Dan said in the Q&A, the increase is positive, but there's still a lot more to be done. And we certainly agree with that, Dan.
Absolutely, absolutely. Becky, in the link that you shared, is it just our HANA report or was it our last report?
It's the HANA report from the final legislative update.
Okay, so that will have all of the bills that we tracked that again, has an impact on people with IDD. Hopefully, if you're signed up for our legislative memos and alerts, the one that we sent last week has all of these bills that I'm talking about in a lot of detail. And it gives a little bit more information than even what that HANA link is going to do, because the HANA link is just going to give you the digest, and the summary of the bill with a link to the whole kind of legal jargon. Our policy memo gives a little bit of the background on some of that too. That might make a little bit more sense. As you go through it, if you have questions, please reach out. We'd love to hear from you.
And if you're not already signed up for the legislative updates and did not receive last week's, if you put your email address in the Q&A, I will forward it to you as well.
Yeah. And I was about to move away from the state stuff without talking about the budget. I have to talk about the budget. And I'm very mindful of time, so forgive me if I talk a little bit fast, but there's a lot I want to get through. One, the state of Indiana did pass its 2-year biennium budget. There was a lot of rumors going around the last 10 days of session of whether or not it might be a 1-year budget because of the $2 billion, and actually it's a $2.4 billion shortfall that the state of Indiana is facing with its forecast. The forecast just came out on April 20th, which was a lot later than usual. So it did kind of throw a monkey wrench into what our legislature had to pass. We again are relatively, okay, relatively content with where the budget landed. We are very happy that the administration from the very beginning wanted to completely fund Medicaid and the expansion, or not the expansion, but the forecasted need for Medicaid. So that is in there. We did see a slight dip in special education, just a very slight kind of shaving of a small percentage on those special education dollars. That's not good. We're not happy with that at all whatsoever. And unfortunately, that never got a lot of attention without, during the conversations at the State House. So it happened in the last, 24 hours of the budget, all behind the scenes, not publicly. A couple of big things that I think are worthy to note in our state budget is the administration did call for all agencies to reduce their budgets by 5%. So for us, this means the Division of Disability and Rehabilitation Services, Vocational Rehabilitation Services, all of them received a 5% a 5% cut off of their operations. So this is, again, DDRS is a very lean agency. There are not a lot of people doing a whole bunch of work. So a 5% cut is huge. That could mean that some of the vacant positions do not get filled, which means that could take longer to move things through the process. This is true for Medicaid as well. So if you think of people who are doing eligibility and all of those renewals, this could slow down that process. I think we are going to see some changes in vocational rehabilitation services. We had just got to the point where we got a lot of our vacant VR counselor positions filled. That's a big deal. We want those positions filled. Fortunately, they're filled now, so hopefully we'll be able to maintain those. But I think, again, the use of those dollars was really important, that we didn't want to slide backwards. So we are concerned about that 5% cut. There is language in the budget that allows the state budget agency to take up to another 5% each year of the biennium. So again, this could now be a 10% cut, and then in the next fiscal year, a 15% cut. All of that impacts the way these agencies work, and we will feel it as recipients of Medicaid. That's one thing to be concerned about. This administration also eliminated the governor's workforce cabinet. That was a big deal because Teresa Colazar, who heads up VR, was on that workforce cabinet. She made sure that as the state of Indiana was looking at attracting businesses to the state of Indiana, that people with disabilities was part of that workforce conversation. That workforce cabinet goes away. many of the things that that cabinet did are being rolled into the Department of Workforce Development. So that's a good thing because we have a lot of really good champions over at the Department of Workforce Development. But we're going to have to continue to be loud about making sure that people with disabilities are a part of these conversations. Again, hopefully that's not that difficult to do, but it's just, another layer, quite honestly, of people that we have to get to have these conversations that we need to be having. Um, we also need to, trying to think of where I want to go next. One of the things that um, was concerning to us. So I think when I was here last, we talked a lot about the potential opportunity for a special session, right? So if the federal government reduces the federal match for Medicaid, if they eliminate some funding streams and just block grant it and give it to the state, that might mean that the state of Indiana needs to come back into session, the legislature, and have conversations of how they want to, spend those dollars and run some of those programs differently. Instead of that happening, I think now what we need to be concerned about is there is now language in the budget that says should federal funding, change, the state budget agency can make some changes to agency spending without the legislature. So all of that is behind the scenes, right? So that's what I don't like about it. So instead of coming to the legislature, having the people who are closest to all of us, the 150 legislators who, live alongside you in your community, who hears your stories, have seen all these Medicaid stories, um, that's where we want public policy to be made, right? By the people closest to us, the people that we know, the people that know us and hear our stories. This budget puts language in there that allows the governor's administration to do it in a non-public setting without the legislature. So this means that as we are watching everything happening in DC, we are going to have to make sure that we are talking really closely with the governor's office and really closely with FSSA, who we hope they are having conversations with as they're looking at spending. It's an icky process because you have people who don't understand Medicaid who might be making cuts to Medicaid. And they don't necessarily understand how much money that the state gets back from the federal government on some of these programs. So when they go in and cut without knowing exactly what they're cutting, they could be hurting us more than what they could have if they just went to Secretary Robe to say, we need you to find $200,000. And then he's going to find $200,000, hopefully, from the place that makes the least impact on us. But when it comes from the state budget agencies, sometimes they make those decisions without the understanding, and we feel a lot more pain than what we could have spent. I know that's kind of weedy and messy, so hopefully that makes sense. But I think it's again something we need to be concerned about, and we'll again just be really paying attention to that. Um, I think, again, there's some good things in the budget as well, besides, Medicaid forecast being funded. They're wanting to do some good around pathways. I think they know that pathways is not going well. They're kind of telling the MCEs, the managed care entities, that they have to pay their claims faster to the subcontractors. That will all make services better for everybody who is on that Pathways program. That's a good thing. We did not get more waiver slots funded in the budget, so the waiting list is going to continue to be a thing. And I think we have to just, again, continue to educate legislators about that, express our concern, and hopefully we can see more money given to those waivers as we reset our waivers and hopefully continue to grow the services that are on those waivers. I am going to turn to federal level stuff real fast because it kind of all ties together a little bit. We are still very much waiting for the budget reconciliation resolution to come out. It hasn't come out yet. That's a good thing for us because I think that what that means is that there is not a consensus on where our congressional leaders want to go on our budget. What was released, today's Thursday, so I honestly can't remember if it was late last week or earlier this week, is the president did put out what we call the skinny budget, and it is really the priorities of the president. It's basically an outline, right? That these are his priorities. This is what he hopes to see in the budget reconciliation resolution, and what he is pushing the legislature to go for. The good thing is usually the Appropriations Committee in both the House and Senate, they have their own goals. So they don't necessarily always do everything that the president puts out there as his priorities. And again, I think that there are a lot of members of Congress who are saying that they are protecting Medicaid. They are not cutting Medicaid benefits. They are specifically not cutting benefits to people with intellectual and developmental disabilities. So we hope what we're hearing is true. And again, we hope that they understand that again, as they are looking at Medicaid, we don't want them to cut without truly having an understanding of how Medicaid works and have any unintended consequences of some of these cuts. There are several things, though, in the president's skinny budget we need to be concerned about. One is it flat. This is a good thing, bad thing. It flat fund. There's flat funding for all IDEA programs. So it does fund IDEA programs, but as you all know, IDEA has not ever been fully funded. It has rarely seen an increase. And with the level of inflation, we are still not getting the amount of money through special education that we know we need to give students the appropriate resources. So that is concerning. Good that it's flat and not a cut, but concerning because we know that, it doesn't go far enough. We also know that they have consolidated a lot of he's at least putting forth, he's recommending that a lot of the individual funding streams within education get combined into one. And this happens a lot. We saw it in the state budget as well, where it looked like programs were being zeroed out. What they were doing is kind of combining budget lines. Same thing is happening at the federal level or is being recommended at the federal level. Again, the president is saying, get rid of these specific programs, give all the money to the states, let the states decide what programs they want to run and to what level. So what this means is that we're going to be talking to the Department of Education here in Indiana a lot, making sure that some of these programs continue, make sure that, again, they get the funding that they need. There's already not enough money. So there's going to be a lot of fighting back and forth of where that money goes. There is also language in his bill around a federal voucher program. So school choice, which again will take public dollars away from public schools, make it available to private schools who do not have to take students with disabilities. Students with disabilities do not have the same protections in place, and they don't always get the resources that they need. So that is extremely concerning to us in that education piece. Also in the budget is, again, it does not specify anything around our DD Council, the Indiana Protection and Advocacy, and Indiana, the IIDC, the Indiana Institute on Disability and Community. It doesn't mention those. So we don't know if that means that he's asking for them to be cut or if he's asking for those to be changed at whatever level. We were glad that some monies were released to those entities last week. And we're still kind of waiting to see what that means. The CDC, again, in his skinny budget, has a reduction. There's some, things concerning around Head Start that we're concerned about. So we're watching all of that stuff. SNAP, the the program that really helps people who need access to food, and food vouchers. They're getting significant cuts in the president's skinny budget. We are closely watching that just because we know a lot of people utilize that program as well. Um, there is some language in the budget too, just again around just different funding streams, changing the federal match that each state has on Medicaid. That is a big impact to us if it goes through. Hopefully it won't be to the level that is being discussed right now, and that hopefully those appropriations committees in the House and Senate will not do what is being recommended. Um, I will just mention a couple of other things. There's a lot of conversation taking place around the SAVE Act. This is the Safeguarding Americans Voters Act. It is intended to reduce what they think are immigrants voting in American elections. There is no proof that this is happening as prevalent as they say it's happening, but through some of the recommendations in this SAVE Act, they are going to make it harder for people with disabilities and people who are elderly to vote. We're very concerned about that and paying attention to it. Also paying attention to everything happening with Robert F. Kennedy and around autism. Really pleased that the autism community out in DC, along with the ARC, certainly the autism community in the forefront, the ARC kind of coming up and supporting them in any way, is holding some roundtables. They've invited Secretary Kennedy to be a part of that. Trying to instill in him some evidence-based studies and practice that we hope that he could learn from. Certainly concerned about the whole conversation around vaccines, him putting forth again statements that are not evidence-based. This idea about a registry is very concerning, and just his words are very, very hurtful. So the autism community and the disability community as a whole is really rallying together to again talk to whoever is at CMS and ACL to make sure that good information is being shared and we can kind of stay on top of that. I've gone through a lot in a short period of time. So I apologize if I spoke too quickly. I apologize if something didn't make sense. Again, if we don't get to your question tonight, please feel free to email me. Becky, do you mind putting my email in the chat?
Not at all.
Please feel free to email me anytime around questions. If you want to have a conversation with your legislator, I can happily help you connect with them. I'm happy to be a part of any conversation. Please don't stop communicating with your state legislator. So if you reached out to your legislator to introduce yourself, to share your story, to ask them to vote on a bill or vote against a bill, thank you. Don't stop now. Please continue to, engage with them over the summer. If you know that they voted the way that you asked them to vote, now's a great time to say thank you and to just do a general thank you. Thank you for the opportunity to share my story and information this past legislative session. I know you're going to continue to have conversations around Medicaid. Reach out to me if you have questions or if you need to know, how my family depends on Medicaid. Put yourself out there as the resource. Invite them to engage with you. Invite them to reach out to you. And just make sure that that continues over the summer and fall. Becky, do we have some questions?
Yes, we do. First, before I get to Dan's question, I do see that LaShawn has their hand up. We aren't able to unmute you tonight, so if you do have a question and want to put it in the Q&A box, we'd be happy to answer it that way. So Dan's question is, what impact does the revenue sharing between public schools and charter schools have on students with disabilities?
Yeah, so that's a great question. So in Indiana, a charter school is considered a public school. So they currently get a part of the school funding formula for Indiana, but not all charter schools have to take any student who applies. We have a lot of schools who utilize a lottery for acceptance of students. And we know that, not all students with disabilities have access to those charter schools. We also really need to remember that some of these charter schools and private schools are not physically accessible to students who have physical needs. And that's a huge component. So if they're using public resources, you would think that they should have to, offer that free and appropriate public education. They don't. And you would think that they would have to be accessible to everybody, and they don't have to be. So it is very concerning, and it is dollars that get taken away.
We don't have any other questions at this time. If you have any questions, go ahead and get those in the chat now. We have about 5 minutes left to answer any last questions you have.
So I'm going to talk about one more thing because I failed to mention it when I was talking about the Indiana state budget. When I was talking about the good news that Medicaid, the forecast was fully funded as far as growth for the next biennium. It was funded fully in the first year. The state of Indiana did take some money the second year of the budget from Medicaid. They took some money from Medicaid, from the Department of Corrections, and from the Department of Child Services, and made a pool of money. So Medicaid put in about $200 million. The Department of Correction took in a lot less than that. DCS put in a lot less than that, but they made a pool of money that's called a Growth Opportunity Fund. And so if that second year of the biennium, any of those three agencies needs those dollars, they're going to be able to go back to that fund and access it. However, if for some reason DCS needs more money than what they put into that fund, they might be able to take away some of the dollars that Medicaid put in. So we're not promised to get back what Medicaid put in. So we might have a Medicaid shortfall in the budget appropriation for that second year of the biennium. But that's one way the state of Indiana tried to take care of this $2.4 billion shortage that they knew that they were facing for the 2 years. I didn't mention that we increased the cigarette tax by $2 a pack. That's fantastic. Indiana is a very unhealthy state, so that's going to hopefully help us with some of our health outcomes. Those dollars will be used in Medicaid and other areas, so it helps kind of shore up that shortfall that we knew we were having. There's a lot of people who don't like that because they think it's a regressive tax, because there are a lot of low income people who do smoke. But I really hope that this does encourage people to quit smoking because, again, we all know that the harm that it causes and those long-term health effects end up costing the state of Indiana more money.
It doesn't look like we have any other questions at this time. So we did get a lot of comments that this was great information. Thank
Good.
you, Kim, so much. This was very informative. We really appreciate you taking the time this evening to kind of walk through the Indiana side and also what we can expect federally. So thank you so much. And thank you, everyone, for taking some time on your Thursday afternoon to spend with us and talk about what we can do to continue supporting people with disabilities and their family.
Thanks, everybody.
Thank you.